In patients with atrial fibrillation, clinical guidelines recommend the use of dual antithrombotic therapy, defined as an oral anticoagulant plus an antiplatelet agent, for 6 to 12 months after percutaneous coronary intervention or acute coronary syndrome. After this period, guidelines uniformly recommend monotherapy with oral anticoagulants. A new trial looks at data on a long-term antithrombotic treatment strategy for patients with atrial fibrillation and stable coronary artery disease. In this multicenter open-label adjudicator-masked randomized trial conducted in South Korea, 1,040 adults with atrial fibrillation at high risk for thromboembolism and stable coronary artery disease were assigned to receive monotherapy with standard dose edoxaban or dual antithrombotic therapy with standard dose edoxaban plus a single antiplatelet agent, either aspirin or a P2Y12 inhibitor, at the discretion of the treating physician. The primary outcome was net clinical adverse events, defined as a composite of death from any cause, myocardial infarction, stroke, systemic embolism, unplanned urgent revascularization, or major bleeding or clinically relevant non-major bleeding at 12 months. The risk of a primary outcome event was significantly lower in the edoxaban monotherapy group than in the dual therapy group. Among the secondary outcomes, the cumulative incidence of major ischemic events, defined as a composite of death from any cause, myocardial infarction, ischemic stroke, or systemic embolism at 12 months, appeared to be similar in the two groups. The cumulative incidence of major bleeding or clinically relevant non-major bleeding at 12 months appeared to favor edoxaban monotherapy over dual therapy. The authors conclude that in patients with atrial fibrillation and stable coronary artery disease, edoxaban monotherapy led to a lower risk of a composite of death from any cause, myocardial infarction, stroke, systemic embolism, unplanned urgent revascularization, or major bleeding or clinically relevant non-major bleeding at 12 months than dual antithrombotic therapy. Full trial results are available at NEJM.org.